Good evening, everybody. I'm super excited, especially because this is the first episode of Chat with the Doctor. A very dear episode for me because I love chatting up with experts, because I love upgrading my knowledge, and I'm blessed to have a lot of doctors whom I visit along with Angela and Azriel, that they love to share details. And hence, a message before even we start is that when you go to the doctor, be open to asking questions. Don't worry, they're not going to judge you by the questions you ask. It's only for your learning, because I don't want you to be a mother to just listen to Rashmita and take your decision. I want you to be a mother who researches, understands concepts, and then takes a decision for you and your family and your baby. So, welcome, Doctor. Thank you for being my first guest for my first episode.
Thank you so much. Thank you, Rashmita. It's all an excited evening today.
So, I have a quick, introduction to Doctor. You can now already see on the screen about the Doctor, but I would want to also share it as he is not just a doctor for me. I feel he is a person who actually loves kids. That is my first introduction. And I would feel that, if you think of a dentist or a pediatric dentist, should be somebody who really enjoys, is passionate towards children. And that is something, is one of the introduction to you, Dr. Vivek Jogani.
Thank you. Thank you so much.
But more to talk about him is he's an MDS. He's a pediatric and a preventive dentist. He's a pediatric orofacial growth and development specialist. And he's also a orofacial myotherapist. We will talk more about this during the session. He is much decorated pediatric oral healthcare provider and was conferred the Best National Oral Presentation Award at ISWWD in 2011 India. Doctor, we will look forward for more awards coming this year and the years ahead.
Yes.
And he has a number of international and national publications to his credit, which I would definitely love to share with you guys, because I will be putting this up on YouTube. And Doctor, I'll need all the links so that we have a lot of reading material for our mothers to be much well-read mothers that I look forward to.
Very much.
Additionally, his experience is been for close to 15, 16 years. And the most important aspect is, in terms of performing pediatric, is root canals, filling, extractions, as well as the management of pediatric orofacial trauma. Let me repeat the last one: management of pediatric orofacial trauma. He has an experienced team of pediatric anesthetists and pediatricians while operating under general anesthesia at leading reputed pediatric hospitals. Recently, the reason for us to delay from Azriel's treatment to today was because Doctor was in Japan. He was at a conference at IRC in Tokyo at a workshop which was about CDKL5. That itself is new for me. It is a genetic disorder. And yes, what he does there is he represents India, as well as he heads the South Asia for the same as a patient advocate. So Doctor will definitely need to know more about things, more about you itself, because these concepts are like, alien to us for a common mother to understand. But I'm sure we are ready to know a lot more and keep these things in our mind if it's explained simple and easily. So over to you, Doctor. If you think I have missed certain things, please add in, and then let's go ahead with the other segments, the other questions that I have for you.
Okay. Thank you, Rashmita. Thank you for a lovely introduction. My primary forte is not pediatric dentistry. My primary forte is working with kids. So I love kids, and I'm blessed to be born on 14th of November, which happens to be Children's Day. And it's a destiny that I chose, and maybe it's by choice and chance both, that I'm a pediatric dentist today. The latest that is happening with us is I'm a patient advocate for South Asia CDKL5. So CDKL5 is a very unexplored genetic disorder. You have heard of Down syndrome, right?
Correct.
So at one point in time, Down syndrome was unknown to everyone. And that's where people from the field came across together to identify, right from clinical features to management, the entire journey of a Down's child. So the same way, CDKL5 is very unexplored field at the moment. And, most of the kids, especially in India or let's say South Asia, that includes Pakistan, Afghanistan, Sri Lanka, Myanmar, Bhutan, we are advocates even for kids from Nepal, Vietnam, and Thailand, Singapore, and India. So when we say this, a lot of kids in this segment over here, they have this primary genetic disorder wherein they have seizures from an early age as young as 2 weeks after birth.
Okay.
And when they reach the neurologist, and because of the outreach in India, basically most in the rural areas, kids are not identified for their genetic condition, and they are treated for their symptom. They are treated for their, they're treated for the seizures that they undergo on a daily basis. So the primary reason to bring up this is to identify the kids. My niece is a CDKL5, and that's where we started this initiative, and it's gone pan across the world. We have kids from all over the world and advocates from all over the world. We meet and we discuss, and research is going on. Hopefully, very soon there'll be some drug to help these kids come out of it. Yeah, so that's about CDKL5, and I practice in Mumbai. I think I met Rashmita when Angela was 2 years of age, or maybe
Yes.
younger to that. Yeah,
Younger to that, doctor. Yes.
yes. So that's how it is. I think that's sufficient for
And
the
yes,
evening.
along with not just he is born on the 14th of November, to add on, he's happily married as well,
Thank
and
you.
blessed with a baby girl who is 5 years old.
Yes.
And he's married happily to Pooja
Yeah.
for 10 years now.
Yeah,
So,
it's been
like,
10 years. And the major role goes all thanks to Pooja, because she's been the support system all this while. Apart from being a pediatric dentist, what you have been, highlighting, the pediatric and the preventive dentist. So here I would like to focus the point that we work more on orofacial growth and development of the jawbones. So I'm from the one of the first batches to be trained across in the US, wherein after completing my master's, I further went in for further studies for, helping the kids with growth and development issues. These are not primarily only growth and development issues. These are also tackling the abnormal oral habits that includes mouth breathing, tongue thrusting, thumb sucking, lip biting, nail biting, and so on. And these habits have a deleterious effects on the development of the jawbones. And that is where parents don't identify at an early age. And going forward, then the child lands up in braces. So the technical term preventive dentist is very important, wherein we work on prevention of abnormal oral habits such that the growth itself is the natural treatment for them.
sure, doctor. Doctor, in terms of prevention is something that I always look at, and there's a lot of mothers who keep talking to me that how is it that you don't give Azrael medicines? I've even stopped medication for Angela for cold, cough, for fever. So what I just want to share with you, mommies, is read what is fever, read what is cold, read what is cough. When you know what is the reason it is triggered in your body, you will know that it is natural. So you need to understand what is natural and what is not, and what can impact your body. And that's the way for us to go ahead.
I totally agree with Rashmita. Matter of fact, even after doing a root canal, we don't give our kids antibiotics. And my clinic is known for medicine free clinic, because we try to identify the root cause of the problem, and depending on that, so maybe for an extraction we would give 1 or 2 doses, not for prolonged 2-3 days, on an analgesic. But if it's a root canal and if it's a clean case or something, we don't believe in blind exposures to antibiotics for every case. So case selection is again very important.
And a special thanks to Pooja for giving all the time of doctor with the patients, because if you really do not understand a life of a doctor, you should watch this series on Netflix called Grey's Anatomy. That
Yes.
really will open up the eyes what happens and how family life and the life of the doctor, the balance that they play. Hats off to them, whatever they are
So,
doing.
yes, so Pooja is again a working lady. She is a chartered accountant and she herself has a busy schedule. But yeah, she sees to it that everything is balanced. And when you say that it's a pediatric dentist and there would be no emergencies, it's not the case. We do have emergencies. The major emergencies that I have is orofacial trauma, which comes up only on festivals when the kids are at home or on vacations. I have hardly come across when kids are having full-fledged school and a trauma coming up to us. So major traumas come up around Diwali, Holi, and I have a couple of cases which I had to leave my, family functions and attend these traumas in the hospital because the child would have fallen down or tripped or whatever.
Okay. Okay. So, Doctor, starting with my first question,
Yes,
because it is the modern millennial age,
very
and
much.
parents increasingly recognizing the importance of devoting time to the dental well-being of their infants and toddlers. Do you really think that, the millennial age is making any impact? Are these parents doing anything different?
It's a mixed answer. Definitely a yes when it's the first child,
Okay.
and a no when it's the second child.
Okay.
So with experience, parents settle down.
Okay.
Secondly, considering the practice in Mumbai, what we have observed over a period of time is it's more of nuclear families. So the parents coming up for dental issues or reading more on dental issues is increased leaps and bounds than what was earlier.
Okay.
Yeah. So millennial age, yes, definitely it's been a boon. A lot of parents are concerned for the oral habits for their, baby tooth, and more so parents visit on the milestones, first tooth eruption and the first milk tooth when it falls off. So we have seen a lot of parents, the trends changing from what was in early 2000s to 2020 and now.
Okay. Okay. So, Doctor, do you think, because you spoke about being the first one to, specialize in the orofacial space, so do you see that we have a lot of doctors in India who practice the way you do, or we have very few doctors in India who are specializing in these spaces?
Okay. I'm not the first one. I'm from the first batch.
Got it.
Okay. Secondly, yes, we do have a lot of doctors coming up now practicing this, but with experience, you could say we are very handful of them.
Okay.
So more than a decade experience, more than 10, 12 years of experience, there are very few, you can count them on your fingertips.
Got it.
But over the past, few years, maybe in the last 5 years, a lot of pediatric dentists are going in for further super specializations.
Okay.
They're upgrading themselves, and yes, the experienced ones are very few.
Got it. Thank you, Doctor, for the clarification about this particular point, because as you said, we are seeing a rise in parents coming in. So that means with the demand, we need to also have right doctors in the country to address these issues as well. So going to the next question, what do you think are the critical concerns that parents may not be completely aware, but which can negatively affect the health and well-being of infants and toddlers if left unaddressed completely?
Okay. There are so many, out of which I've selected the most important ones.
Okay.
To start with, thumb sucking.
Okay.
Thumb sucking is the most neglected part, wherein parents feel it's absolutely fine when they go back to their grandparents for advice or their parents for advice. Most of the parents have this myth that, thumb sucking is absolutely fine. So thumb sucking is one of the critical concerns which I feel that the parent should be aware of until what age.
Okay.
The second one is again bottle feeding and prolonged breastfeeding. I think most of the breastfeeding part and the bottle feeding part we would be discussing today, but prolonged bottle feeding, that is after, even after weaning, mothers after weaning from breastfeeding, they shift to bottle feeding, understanding that it is absolutely safe. No, it is not so. It is a concern because you are not selecting a natural nipple, the anatomy which the mother's nipples are, the same anatomy is not followed in the bottles that are used randomly. So, and prolonged breastfeeding can have deleterious effects on the development of the jawbones of the kids.
Okay. Okay.
Yeah. The
Yes.
next one is post-COVID. We have seen a very spike in this
Okay.
mouth breathing
Okay.
because of the decrease in outdoor sports or activities and increase to screen time. A lot of kids have become mouth breathers, and parents are absolutely fine with it, or maybe they are not yet aware of it. A mouth breather need not mean breathing through the mouth heavy. It's not, no, this is not mouth breathing. Mouth breathing is a posture wherein the lips remain open, even if it is 2 millimeters apart at sleep or at rest while watching a television or writing or reading. And the child is slouching and sitting like, a dumb posture wherein. So that's what mouth breathing is all about. It is a concern. The major impact what we have observed in last few years is screen time, especially screen time while feeding when the kids are eating. So working parents, nuclear families, ayahs and grannies taking care of the kids, and they want to feed the child, they put on the screen and the child has just been, you know, force fed without the child realizing or without the parent realizing that, the child is full or not. Because the screen is on, the child may eat something extra which is beyond, and without the screen time, the child may say, I'm done. So parents don't realize what they are feeding, how much they are feeding. And if you ask the child at the end, maybe even after an hour, what did you eat? The child will never remember what the child has eaten if it's eaten during a screen time. And with the rise in the screen time, the time duration for feeding also increases. Kids start land up eating for one hour altogether because they would want to see more of the screen. And when this happens, obesity sets in. And the most classical and the most concerning thing to me right now is autism, wherein the child kids out of 10, we see almost 6 kids on the spectrum. They are not full-blown autistic. Maybe they are hyperactive, ADHD, or something of those kinds, initial symptoms. So this is the most concerning part. It's very critical for parents to realize about screen time. I would advise if you could have a webinar on screen time and mouth breathing.
Sure, doctor. I
Yeah.
will definitely. And just to share that, I think just 2 or 3 days back, I had somebody connecting with me on Instagram and talking about visual autism. And I myself didn't know about it. And when I saw, that's when I realized that screen time can also result in these impacts. And that's when I told her that if you have been guided by the doctor, what are the right things to be done? And it says that it can be reversed, then you have to follow it. You have to practice to get it back. But if you cannot give time, because then I asked her, are you working? Are you a full-time mother? Do you have help? Because if the mother needs to spend time, then she needs help from multiple people. It cannot happen that, she is given the responsibility of managing the home, doing all the housework, and then take care of the child. It's not going to work. So I did advise her that, you need to seek for help so that then you can spend enough time with your child to bring the child out of the treatment that the doctor has prescribed, or however the session or the counseling is currently happening. So in terms of the
I
next.
would want to add, they say it takes a whole village to raise a child. So it's not primarily the mother's duty to do everything. It's, equally the father, the grandparents. So wherever whosoever's role it is the entire family who has to work on kids. It's not that the only mother should be taking care of it.
Absolutely, doctor. I think the abuse maa ne kuch sikhaya nahi hai has to change for good, for sure. And
Yes.
I think that because anything good or bad, things
It's the
change.
mother.
Yeah, absolutely.
Yes.
So let me go to the next question, because you also spoke about genetics when we just started. And this is related to genetics, because do genetics influence the occurrence of dental issues, including the timing of tooth eruption? Because this is a underlining concern to all mothers. Forget about mothers, but grandmothers too. when they see that the tooth is not erupted in the 7th month, 8th month, it's a a constant ask from the grandmothers that okay, it's not come, you had it, why did the child not get it? So doctor, this question is for you now.
Yeah. This is a big chapter, genetics. First, you need to understand what is genetics and what is hereditary.
Okay.
These are two terms which are used, exchanged for each other. But these two terms are altogether different. Genetics is the makeup with which you are born with. It is inherited in your family, right from your ancestors, whether it's the mother's lineage or the father's lineage. Hereditary is again a misnomer which is used with genetics. ये हमारे hereditary में है, ये हमारे genetics में है. So it is not like that. So genetics is the makeup, and I will come up to this word again. Now, when we use the word hereditary, it is very commonly said that when we take a medical history, parents or sometimes they say, when we ask, do you have diabetes, sugar, or do you have blood pressure? हाँ, ये हमारे खानदान में है, ये हमारे hereditary में है. No, your hereditary never passes on diabetes. It never you cannot pass on diabetes to the next generation. You cannot pass on to hypertension or cardiac problems. You can pass on the predisposing factors.
Okay.
So these are man-made diseases, so they cannot be passed on. Now let's understand the next term, epigenetics. Epi means environment. So the environment that is acting on your genetics. So the genetic makeup remains the same, and epigenetics means the environment on which your genetics are being worked on.
Okay.
So what was your environment when you were a child, or what was your grandmother's environment when she was a child, is different from what is the environment for your child right now. Your grandparents never had exposure to gadgets. They did not have mobiles in those times. Forget 4G, we never even had any G at that time. Okay. Right now, each child is having an exposure to a gadget, whether it's a tablet, it's a phone, or it's a TV, or it's a laptop, or it's the screen in the, screen in the classrooms. So the environmental factors are these factors that are working on our kids' genetics. So now when we talk about how this, request you to please mute yourself.
I've just done that for yes, doctor.
Yeah. So now when you ask, does genetic influence the occurrence of dental issues? Yes. Genetics influences the occurrence of dental issues because I have done, this is my study, this was my thesis when I was doing my master's. I have done a thesis on S mutans level. S mutans is the name of the bacteria which causes dental decay. So I have done a thesis wherein we studied the saliva of the baby 0 to 2 years of age until the tooth had come, or the initial teething stage, and their respective mother's saliva. And we identified whether if the mother had an increased tendency of S mutans levels in her saliva, was it reflected the same pattern in the child or not?
Okay.
And the odds ratio said that yes, if the mother had high S mutans level, the corresponding child had the same or maybe a higher chance of S mutans level in his or her saliva. So genetic makeup plays a role, but there's a but over here. So the environmental factors, that is exposure to recent toothpaste, the good sized toothbrushes, the healthy food, the literature or the knowledge that we share with each other, can help you come away from this. So it does not mean that I had dental decay, my child should have dental decay. My child can have dental decay, but my child will not have dental decay. Now you understand what I'm trying to say?
Yes, doctor.
So what I'm trying to say is, if I have dental decay, my child will have a higher chance of having a dental decay because of the genetic predisposing factors. But the environmental factors, what are working right now or helping the child in today's era, are different from when I was a child. Now, another environmental factor was when we were kids, maybe a simple bourbon or a cream biscuit was to be shared with an entire family, among all the siblings. It had to be shared. But today's kids have their own separate pack of share. It is not to be shared. Each child is given one pack. Ferrero Rocher was a luxury chocolate. Today, it is available at a local kirana shop, a local bania.
Yeah.
So those are the factors which have changed. The type of candies that were there earlier has changed from then to today. Okay, so this is one thing which you need to understand. Now, coming on to the second part of the question, timing of tooth eruption. Yeah, this is again very important. This is dependent on whether the child is a cesarean child
Yeah.
or a normal delivery child. Now, this would be, surprising to you how I'm correlating. Yeah. Many a times earlier, everything was a natural delivery.
Okay.
There was no pitocin given to the labor mother. The mother used to go in for labor pain for hours until she delivered. Most of them were delivered at home with the help of dyes or nursing home. But
Yeah.
now with the exposure to big corporate hospitals, the mothers fearing undergoing uh, normal deliveries, they choosing to take up cesarean deliveries. And now we have something called as nakshatra deliveries. So nakshatra deliveries is where mummies go to their pandits, or the family pandit decides when should you, take the child out, when should you deliver the child. And that's how OTs are booked today. And as per the nakshatra, so you are going against nature level. That's a different story altogether. But so when most of them are C-section babies, or most of them are planned deliveries, so most of the ladies are put, pregnant ladies are put under a medication to induce labor by pitocin. And when this false hormone is secreted in the blood, false hormone means it's an artificial hormone that is secreted inside the mother's body. It gives a signal for inducing labor pain, but it does not give a signal for induction of or starting to produce breast milk.
Okay.
Yeah. So when this C-section babies, or late deliveries happening in the early 40s, late 40s, so kids may have a chance of delayed tooth eruption. So this is the environmental factor which is working today. Yes, there's a big correlation when nannies and daddies say that you had, maybe you had delayed eruption, so your baby will also have. There is a big possibility, but you cannot rule out the other environmental factors that are working right now on your genetics. Now, when you have raised this query, delayed tooth eruption, it is absolutely normal as long as your child is active, playful, and healthy. Okay. The earlier concept, the timetable that we follow is 6 to 8 months, the first tooth should erupt. But in my own personal experience, Navya's first tooth, my daughter's first tooth, came up at around 11 months of age. The second tooth came at 14 months of age. And thereafter, the teething was, she had an entire set in another couple of months, maybe 4 months or 6 months ever since. So by 18 months, she had the entire dentition. So there's nothing to worry if there's delayed eruption, but you need to identify that the child is healthy. There is no sparse hair, brittle hair, dry hair, or the child is having repeated fractures or something underlying. Then you definitely need to check on the hemoglobin levels, the calcium levels, and the vitamin D levels. But on an average, out of 10, if you ask me today, out of 10, say 7 kids are having an eruption average age of 10 to 12 months today.
Yep.
Yeah.
Just to add in, because doctor spoke about C-sections. So, I mean, I had an amazing time with my doctor during my delivery for Azriel's time. And I will be having a webinar with him soon in the coming days for sure. And I was prepared to go for a normal delivery, because it's also a misconception in a lot of, women, that post you have a first baby, which is a C-section, you cannot go for a C-section the second time. And I asked him, and he said, see, if I would have been your doctor, and I would have done a C-section, I would have tried and looked at things so that I could go for a normal delivery. And then he was like, then I asked him, why not? So he said, the reason I'm saying that, because the babies would come out from the most easiest way. So if the easiest way is the cut, then, it would come out, and that's not something that we are looking for. And that's why he said, and post my, delivery through the C-section, doctor said that, there is no way, the first doctor has done your operation, that there's no way you can have a normal delivery ever. And that really shocked me. And I was like, oh, why didn't I pick the right doctor then? So it's very important, mothers, if you're looking at your second pregnancy, third pregnancy, or whatever, whichever number that is, please look at, natural birth. It's not that I'm going to tell you saying that do not go for alternatives. Yes, if you're not sure. But yes, if you can go for the normal way, why not? And pick the right doctors so that they can support you with the decision that you are making. So, doctor, going to the next question with regard to is in terms of how can you provide clarity and simplify the process for mothers? This is a very common question from a lot of mothers, because I think the majority concern is only about toothbrush and toothpaste and not going beyond this. So just want to address this so that mothers have a clarity that, okay, what should I pick and what should I not pick? And why should I pick a toothbrush or a toothpaste in a particular manner?
Okay, so this is the basic that we answer on a daily basis. It's a most common question. What is the best toothbrush? What is the best toothpaste? Let's start this in age-defined manner so it becomes easy for each of the mother over here to identify and relate to his or her child. Now, the first is the toothbrush. Any time that you're selecting a toothbrush, whether it's a pediatric or an adult toothbrush, see to it your toothbrush is a soft bristle brush. Never ever use a medium or a hard bristle toothbrush because you're cleaning human tissues and not utensils. Yeah. So a soft bristle brush is what we look at, and this is what you're supposed to use. Now, the second factor in selecting a toothbrush is the head of the toothbrush. Is this visible? Okay, I think it would be visible if it's in front of me. Okay, so the toothbrush, this is the handle, the shaft, and the head. The head is the portion where the bristles are attached. So always select the head, which is a small size head. The most common mistake most of the parents do is they select a brush which is having a big size head for a reason that they understand it will clean more and it will clean better. No, this is not so. You have to be selecting.
Go ahead, doctor.
Yeah, you have to be selecting a toothbrush which is having a small head such that it reaches the last tooth. So if this is your oral cavity, the front areas are all accessible, you can brush well. But if you have to go deep inside on the back molars, if you use a big head size toothbrush, it will never reach. So the trick of the trade is always select a toothbrush which is soft bristle brush or maybe an extra soft brush for young infants and a small head size. Now the next toothbrush, so the next toothbrush is a finger brush. So to start with cleaning, when the baby, when you're breastfeeding the child and none of the tooth has erupted, you still have to be cleaning the gum pads because there's milk pooling all around the tongue, all along the ridges, the lips, the inner cheeks. And that's where, they start getting this foul smell, halitosis, and cuddling happens most times. So after every feed, you can use a soft muslin cloth, wrap it around your finger, move it around your child's oral cavity. And if you've started with water, then you can give few plain sips of water after every nursing, after every breastfeeding or bottle feeding. Now, after the first tooth has erupted, you can use a finger toothbrush, which is a silicone toothbrush worn on the finger. And this is very soft, delicate bristles. So you can use this until the child has around 1 to 8 teeth. Once the child is having 8 teeth plus, you can take a small head-sized toothbrush until the child is 6 years of age. The handle size should be maximum. It should have a long handle and minimum size of the head. So that is until 6 to 8 years of age. Thereafter, you can shift to a pediatric toothbrush until the child is 12 to 14 years of age, and then a regular. Even for that matter, adults, you should select a head size which is smaller in size. Okay, a sleek one such that it goes right till the last tooth, till the last molar. Now, the second part, that is your toothpaste. Toothpaste, there's no personal recommendation. Every toothpaste is good. These are all marketed for their flavors, for their colors, for their ingredients, for their packaging, and how it has been marketed, to the sensitive population, that is the mothers. So until 2 years of age, you should be using a non-fluoridated toothbrush or non-fluoridated toothpaste, and the quantity of your toothpaste should be a rice grain size. I repeat, until 2 years of age, a non-fluoridated toothpaste that is a rice grain size, and after 2 years of age, you can use a fluoridated toothpaste. Indian kids can definitely use a fluoridated toothpaste after 2 years of age, and the quantity of toothpaste should be a pea size. So, matar ya shingdana. So that size of toothpaste you should be using for 2 plus. Okay. Now, the next important question is, which one do I recommend? Any and every toothpaste is good. Using any particular soap will not make you fair. It's just the feel of freshness. It's just the feel of cleanliness, and you feel good about it. So it's a personal choice. One would like to use XYZ, the other would like to use ABC. What is important is to take shower. Similarly, what is important is to use a right toothbrush and the toothpaste and doing the brushing activity in a correct form. Okay, simply doing the brushing also is not correct. You have to brush in a correct way such that you clean and you reach each and every area. Most important, after 4 years of age, is you should also be using dental floss, because there are contact areas between the teeth which are never, accessible to your toothbrush. And this accounts for 40% of the total tooth surfaces. So every day, if you're brushing, you're just brushing 60% of the tooth surface. The interproximal areas, or the areas that are in between two teeth, are not being used or not being brushed. The next one is, after toothbrush and toothpaste, is mouthwash. The best mouthwash is a pinch of salt with warm water, and that's sufficient, more than sufficient. Do not use prolonged mouthwashes which are marketed. It alters the taste buds of the child, of any individual for that matter. Prolonged use, it starts staining the teeth. And I don't personally recommend long-term or prolonged-term use of mouthwashes. Most important that I would like to share today is when to change your toothbrush. You need to change your toothbrush after every 3 months. So buy 4 toothbrushes every year and keep, so you have a reminder. So now, if today on 8th of October, how are you going to remember is you change your toothbrush today, and irrespective, 1st of Jan, you change your toothbrush. So that's how you will calculate for the entire year. Most important in kids is never keep the toothbrushes in the washroom, in the toilets. For that matter, even in the cupboards of the toilets, toothbrushes should be stored outside the bathrooms, outside the toilets, because when you flush, the aerosol that is generated can, it is in a small confined area, and that's where they get contaminated. Second most important aspect is you should always change your child's toothbrush after every episode of fever. So if you have changed your toothbrush today, and if the child has fever after a week, the best would be either change the toothbrush immediately after fever, or if it's just you have used new toothbrush and you don't wish to discard it, then do not use that toothbrush for another 1 month. Keep it dry inside the cupboard, and then you may again start reusing it. So this will help you, get rid of the viral loads which are usually there, because toothbrushes are moist when you keep, you cannot dry them when you keep. So it's always loaded with water. The viral load, the bacterial load, whatever is in your oral cavity is directly proportional on your toothbrush. Yeah. And see to it that no two toothbrushes in the family touch each other when you are storing them. If this happens, your environmental factors acting on your genetics become strong. And then you say, हमारे खानदान में सबको cavities होता है. That's because that's how you are sharing it. Yeah. Any doubts on this?
I don't know what people did when the families had COVID, but every time we felt somebody had COVID, even the toothbrushes were segregated. Like,
Yes.
you can't keep the toothbrush, nothing can be.
Very
Because
true.
you don't know by the time you are positive. So as soon as we feel that, okay, there are symptoms, the slightest, we would alienate the toothbrushes. And even I think the other thing is napkins, because I think the washrooms are compact, and because of I don't know, aesthetics that we look at, we always have the brush there, the tongue cleaners out there. Immediately you have a hand napkin. So all this, if you want infections to not move from one person to other, the rules that we put in COVID is something that we have to follow in a daily life to actually not pass on germs, viruses to each other in the family. So just adding on there, doctor.
Yeah, so most important part over here is the aerosols. We don't realize if you put colored water in your water tanks and then you flush, you will realize after a few hours that there are aerosols which are, at a distance of as much as 8 to 20 meters. So the entire bathroom is always contaminated.
I've read about this and I have put it in practice to close the flap
Lid.
flushing, but what happens is I can't control the entire family. So the change can happen from my end, from Angela's, because I am mentoring them, but I can't change the adults. It is a very difficult to change that. Instead, changing the pattern, because this was an argument that happened with my mom and my younger sister, doctor. And it was like she has a habit of hanging her clothes in the bathroom.
Yes.
My mom was like, what is this? You're putting it there. It's in the bathroom. It's dirty. So my sister asked, so what about the toothbrush? My mom was like, Mom, like, what do I tell this? And absolutely, that is a bang on point. That
Yes.
you want to make that if you're concerned about the clothes, what about the toothbrush, which is there sitting day in, day out, going in your mouth? So let's go to the next question, doctor.
Yes, sure.
So there's a common belief that teething can cause children to reject food. And the most important concern for mothers, which also brings tears in their eyes, is babies not eating. So based on your personal experience and your professional experience with your daughter, Navya, do you think this holds true? Or are there other factors at play?
Well, the personal experience would, help you more better. Teething in my daughter, I never experienced any major challenges. Rather, it was just a milestone. For that matter, it was the same in all the family kids, all my niece, nephews. So it was,
Yes, go ahead, doctor.
yeah, so it was more of milestone rather than, suffering. Okay. Now coming on to the professional part of it, yes, teething does happen, but teething cannot happen for days together. It's just a phase for maybe a day, 2, max 3 days. It cannot happen that my child is teething continuously for a month. So you cannot run away from this. Yeah. Second is most important over here with teething is there are prodromal symptoms that could be fever, that could be pain, there could be some kind of discomfort to the child. So, and increased drooling, increased salivation. And most common concern that parents say is teething ke time pe my child is having loose motions or gastric upset, diarrhea. When teething happens, kids tend to put anything and everything in the mouth. And that's where cross contamination or infection happens. And that's where the gastric upset happens. Secondly, during teething, there's no direct relation or any research or scientific evidence available that it is with teething, diarrhea always happens. Now, when we say that teething is painful or my child stops eating, then you need to identify the factors, or maybe sometimes kids go in a phase wherein they would not want to eat for a couple of days. It's an personal thing. Like if I suffer from fever and post fever, maybe I may not like to eat for 2 or 3 days. But when it comes to kids, the entire family starts getting disturbed, and especially the mothers, their concern raises, and the only concern is my child does not eat. Let me tell you, it is very healthy for the child to skip a meal. And at times, if the kid is not willing to eat, do not force feed. We are not making them starve. We are not allowing them to starve. Starving is different. But missing a meal sometimes, once a week, once in 2 weeks, or during the phase of teething, you may concentrate on liquid diet. You may concentrate on plenty of fluids. You may give them teething rings. But I'm not a personal fan of this teething rings because I'm not sure how much BPA free they are or how clean they are. Instead, what you can do is you can wrap a favorite fruit of the child, especially a juicy fruit, a citrus fruit, in a thin muslin cloth, keep it in the refrigerator, chill it, and give it to the child to play and mumble with. So when they are teething, they like to put, and babies, we are talking about babies right now. So they are infants, they are 6 months, 8 months, maybe a year old. They would put it in their mouth. And they like the cold effect, they like the pacifying effect, it gives a soothing effect to them, and they feel comfortable. And you can just discard the muslin cloth after that. You could also use frozen spoons. You could also use frozen cucumber or carrot sticks. See to it that you give them big sticks, a thick one, so that if you give them thin ones, there's a tendency that they may break it and then they get choked. Give them something which they can nibble on because they are having no tooth. And teething is primarily seen in when the first tooth erupts, either the lower or the uppers. When we see teething for the molars, it is not really concerning because by then the child has passed through that phase and then they manage by themselves. So it's all about symptomatic relief. And yes, you need to visit your pediatric dentist just to be sure that things are in the right place. It's not an emergency that you have to visit. You can plan it up, but you should visit. So the first dental visit should happen around teething or maybe when the first tooth erupts at 6 months of age and not later than first birthday. Anything you want me to add on teething?
Um, I think there is a misconception because we spoke about teething sticks, and they do not have teeth, but they have gums. There's a lot of notion that babies cannot bite, or they can't actually be given solids. But that's actually not true, is what I know. But doctor, I think you will be a better person to talk about
This is,
the
yes.
strength of gums and the teeth. Like if you can talk on that for sure, because I was just putting that down in my Q&A, but you can take that up here as well.
This is something, I really appreciate this query because many parents have that मेरे बच्चे का दांत नहीं है तो वो खाएगा कैसे? you know so no, it's not like that. Nature has designed us such that at every stage of life we are self-sufficient. So when the child is having no tooth and the child is until 6 months of age, he's on breastfeed, and that's after 6 months, irrespective whether the child has tooth or not. Your pediatricians, your dais, your grannies, they all advise you that introduce top feeds by 6 months. You cannot be putting the mother to stress all throughout for the initial, the later nourishment. First 6 months is what the mother has to nourish the child. After 6 months, the top feeds come into picture. So by 6 to 8 months, definitely the child can be fed semi-solid, for that matter, even solid food, paratha or home-baked idlis or something of those kind. And even if the child does not have tooth, the child can very well chew on this solid diet because their gums are tough, their gum pads, they are tough, they are tense, and they have the efficiency to bite on the food. So don't be under the impression that jab daat aayega, we will introduce solid food. You have to introduce solid food at the right age so that the child learns to chew. And only when the child chews on the solid food, the teething process becomes easier. So when they are chewing, the gums are getting massaged, they are getting, used up, and that's where the teething, the flowering of the tooth gets easier. If the gum pads are not used and you are more on pureed diet or liquid diet, then teething becomes a difficult process.
So there's a lot of correlation, mothers, right from the way you're going to nurse your child to your genetics and how you're going to introduce solids to your child. So all these three things are having correlations, and it's about how you take care of these elements or how you guide somebody who is going to take care of your child in your absence. So, doctor, there's a special segment that I've created which needs to be addressed, and especially this segment when I shared with you one of the concerns when I put up a story, and one of the doctor mothers who reached out to me and said that I don't think your story is right and you should pull that down because you are not sharing the right information, and mothers might feel that they need to stop breastfeeding.
Hmm.
So this section is all about myth busting. So over to
Okay.
you, doctor. So share with us at least 5 myths, or I'm sure there'll be more, but 5 top in your mind that the world keeps talking about it. Not only India, but I think the world is all talking about. These myths are myths, and we need to understand what is the reality.
Well, this is a very important segment, I feel. With regards to myths, it can be a never-ending story. There's a lot of debate going around, but yes, we are with a lot of scientific evidence. So the first one with most of the parents have is, sorry, uh, my child has a cavity and it's a baby tooth, it's a milk tooth. It will fall off. Why should I get it treated? Why all this fuss? Well, it's a myth that you should not be treating it. You should be treating whether it's a milk tooth or a permanent tooth. The primary goal is the oral cavity should remain infection free. It has to be zero cavities. One. Two, even if it's a milk tooth, nature has designed this milk tooth for a certain age fragment. You know, all the mammals don't have two set of dentition. They may have three, maybe the cows and the sheep, their teeth keep growing all throughout their life. But in humans, we have two sets of dentition. We are the only blessed species who have two sets of dentition. One is the milk and then the permanent. So if nature has designed the milk tooth, it is designed for a specific purpose. It is designed for a cause. So milk teeth not only help in looking good, the teeth don't enhance your aesthetics, it also helps in chewing food. So at the right age, if the child's molars are cavity free, they learn to chew food, and that's how the chewing pattern, the mastication of the food, the swallowing, and they relishing on the taste of any and every kind of food comes up into picture. So you have to treat whether it's a milk tooth or a permanent tooth, you have to treat a milk tooth. The another reason for treating a milk tooth is each milk tooth harbors a permanent tooth underlying them. So it acts like a worm or a protective mechanism for the developing permanent tooth buds. And if you have an infection in the milk tooth, there is a good chance that you're passing on the infection to the underlying permanent tooth. So yes, milk teeth treatment is very much needed, and hence the field of pediatric and preventive dentistry. The next common thing is any kind of dental procedure where anesthesia may be required, or for that matter, if you have to undergo an extraction. If I have to extract a child's tooth, will it affect my child's eyesight? No, it will never happen. Because if the connection was the same, the ophthalmologist and the dentistry would have been the same field. We cannot be a separate field because we are studying a separate organ altogether. Second is, in between your eyes and your teeth comes your ear and your nose. So they too should be affected if this was true. And the most important factor was in earlier ages of practice of dentistry, we didn't have good anesthesia. So if you go down to 1980s or till 1990s, when there were no good anesthesia, and when the tooth was to be extracted, when anesthesia was not profound or it did not act fully functional, and you extract the tooth, you have some kind of pain. And then you feel the entire stress radiating up to your jawbones or your head. But now we have excellent anesthetic solutions. So this myth that, working on a tooth will affect my child's eyesight or brain does not hold good. Third myth, my child does not have chocolates or we don't give sugar, yet my child has dental decay. Or my older child or my cousin's child has a lot of chocolates but zero decay. So chocolates cause dental cavities is a myth in today's era. Let me, reframe this. It is important that we need to identify which era we are talking about this myth about. So if we take a simple Cadbury, which is readily available in the market, I would not take a typical name, but the most common one, which we have it in India, if you eat it and you open the mouth after 10 minutes, it will be all dissolved. But if you eat a simple biscuit, whether it's a non-cream biscuit, and you open your child's mouth after 4 hours, it would be stuck on the last molars down there. And that's where cavities start. So it is not the chocolates or the Cadburies that cause cavities. It is the sticky nature of the refined food or the increase in snacking in between meals. This is an important factor, wherein if your lunch is at 1 p.m. and if your dinner is at 8 p.m., and in between that, if you're going to give your child snacks 7 to 8 times, maybe 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock, you're going to have cavities because every time that you eat, the pH of the oral cavity drops. The neutral pH is 7, and our oral cavity pH would be somewhere around 6 to 8, depending on an individual. So when the pH drops down to 3 or 4, it is the acidic medium that comes into the oral cavity, and that is what erodes the tooth and not anything else. So for that matter, if you have given your child a sandwich at 4 o'clock, chips at 5 o'clock, a cola at 6 o'clock, or maybe a juice at 6 o'clock, 7 o'clock, something else, you are increasing the frequencies in between meals. So all you have to do is decrease the frequency of snacking in between meals. So I come back, chocolates are not the cause for cavities if you maintain good oral hygiene. It is the sticky nature of the type of food that you are eating and the frequency with which you are eating. Now, coming on to the next myth, my husband snores, and so does my child. This is absolutely normal. No, it is not normal. If your husband snores, it does not mean your child should be snoring because snoring is not healthy. And as I have clarified, it is the environmental factors which were working on the husband when he was in the younger age group and what the environmental factors are working on your child are altogether different. So it does not mean that everyone in the family snores, so coming generation should also be snoring. You have to break that cycle. You have to put a stop to that cycle. So mouth breathing is not healthy. If the father snores, so the child should also be snoring? Absolutely no. So mouth breathing is not normal. And at the same time, everyone in the family snoring is a myth if it's considered to be normal. The most important factor, breastfeeding is safe. Yes, I very well agree breastfeeding is safe, but not until the child is having a full set of dentition. So nature has again designed breastfeeding as an important nourishment part of the child until the child is having 6 months of age. Once the teething starts, you have to bring down the frequency of breastfeeding and start with the top feeding. So it's like balancing it out. Gradually, you bring down the breastfeeding and you bring the top feed, and then you balance it out such that the child can self-sustain himself with good nourishment. Each child comes from a good background, from a good family, and every parent wants to give the best to the child. So when the child has started eating, you need not breastfeed the child. So for an Indian child, 15 months to 18 months is the time when you can start weaning the child from breastfeeding. But prolong to that, if you're still breastfeeding the child at night or bottle feeding the child at night, and you're not cleaning the oral cavity after every feed, after every nursing episode, then the possibility of the child having cavity is 100%. This is not what I say. This is what research says, that breastfeeding is healthy. The breast milk does not cause cavity, but the pooling of the milk around the tooth for a long period of time causes cavities, because this milk on the tooth surface forms a layer, it forms a slime, and that undergoes fermentation, and a fermented milk forms acids, and this acid erodes the tooth structure, resulting in cavities. So breastfeeding is safe, but the myth is prolonged breastfeeding in kids, especially at night, and no oral hygiene care does not cause cavities is a myth. Yeah, I hope I clarified most of the myths. There are many more, but due to time constraint, I think we can stick on to this. If you have any questions, I'm open to it.
Sure, doctor. So let me go to the next section.
Yes.
In terms of, we have few mothers who have joined in, doctor. So let's do the Q&A if they have any.
Absolutely.
So just check if anybody wants to share a question. Ami, would you like to share? I'll unmute you mothers in case you have. I'm unmuting Ami Patel. I've asked you to unmute. If you have a question, please do share. I don't see response. I see Nilesh as the name, so I'm unsure the name of the mother who has joined in. Nilesh, who is with us, if you have a question, you can ask now. Okay, I'm moving on to the next mother. Revati, if you have any question, please unmute.
No, I don't have any question.
Sure, Revati. We have one question on the chat, doctor. So I'll just read that out. How mouth smell can be avoided?
Okay. Now, can you clarify the question whether this you're asking for an adult or a child?
Ami Patel?
For a child.
Okay. The most common cause for halitosis or smell from the mouth in the morning is the type of food. So if it's a sulfur-rich diet that includes onions, definitely there'll be some kind of halitosis. But this is natural. The halitosis that occurs in kids, what we see is because of cavities. If there is any food stuck in between the tooth, that ferments in the entire night, and it releases foul smell, which, in the morning you feel a lot of, bad smell from the mouth. Also, halitosis is most common in kids who are mouth breathers. So when you breathe through the mouth at night, the salivation has decreased in the oral cavity and the tooth gets dried up because there's no salivation because of mouth breathing, and halitosis happens. Now, to understand how it can be avoided, you have to identify the root cause of halitosis, whether it's the diet, or it's the cavity in the child's oral cavity, or the child is a mouth breather. So depending on the etiological factor, you can avoid the mouth breathing. The most simple method would be brushing at night after every meal before bedtime. Now, that does not mean you brush and then you feed the milk to the child and then put the child to sleep. So milk, everything is done, and the child is not supposed to have anything later. Then you should be brushing the child's teeth, put him into bed, and in the morning you can brush after having the breakfast. This would be a simple trick to avoid mouth, foul smell from the mouth in kids.
So we have Sanaya. Do you have any questions? Then you can go ahead and ask.
Yeah, hi.
Hello.
Vivek, hi Vivek. You mentioned about thumb sucking. Can you elaborate a little more? And like, when is the ideal time that it should stop? And what can I do for my 4-year-old daughter?
Okay. This is very, important from the growth and development point of view. Thumb sucking is absolutely normal until the child is 1.5, maximum 2.5 years of age for an Indian scenario. Beyond 2.5 years of age, thumb sucking is considered abnormal because it exerts deleterious effects on the development of the jawbones. So you have the upper jaw, you have the lower jaw, and those who are thumb suckers, when they press the thumb against the palate up, in the process, they are pushing the premaxilla. Premaxilla is the front portion of the bone, which is very soft in kids. And if this entire segment of the premaxilla is pushed or thrusted up, the child lands up having proclined or forwardly placed upper and lower teeth. These teeth are so much proclined that you will not realize at this point in time, because the baby fat is one which gives cuteness to the child's face. Once the baby fat dries up and the child is, in the early teenage group, you start realizing that the jawbones are really haphazardly placed, and then you run and rush for braces. So the right time is to put off the thumb sucking at this age. How can you do it at home care level is very simple tricks. When you're putting the child to sleep, see to it that you make the child wear long sleeve t-shirts, kurtas or shirts or whatever, such that you close the hands in the sleeve of the top, whatever the child is wearing. Now, when that happens, the child will not struggle to remove the hand and put the thumb inside when they are in the zone, when they're just going off to sleep. You can also tie the ends of the long sleeve t-shirts or the top what the child is wearing. Second is you can bandage the child's thumb and draw a nice, every day a different emoji depending on the child's mood or the child's favorite, cartoon or something, and stick it up and tell the child that this is what your favorite, minion is there with you tonight. He's going to sleep with you. So, allow it to sleep or allow it to rest. And you can cook up stories. And when you make stories, kids accept well. The minute you start retaliating and you start telling them it's a no, it's difficult for the child to accept. You have to make the child realize in a very friendly manner. So you may put a bandage or a sticker or an emoji and, make stories that, he's going to come in your dream tonight, and let it rest and let it sleep. So we have seen kids not doing thumb sucking with that. The next factor is still the child is very aggressive with thumb sucking. In the night, just paint off the thumb with asafoetida water, that is hing ka pani. It's pungent in nature, it's healthy, it will release all the gas if the child has done it. And once the child gets a kick of the taste, the child will never ever dare do it. Most of the parents use those solutions which are available with the chemist. I would suggest don't do that. Don't even use chili powder water, but use hing kapani as a fetida water. It works excellent.
Add on, doctor, this is
Yes.
also used when weaning off from breast milk.
Yes.
Feeding, they use this. Plus, my mom had bought something for me, which traditionally is used in a lot of places. So I will also share that link during uploading, because it is a aloe vera resin. That is what it is. So that also can be used because it has a bitter flavor. So with Angela, I used it, but with Azriel, it was all through talking that I have let him stop breastfeeding and breast milk. But with Angela, I did try it. So I thought, why not try something different with the second one? So yeah, just adding on to, if the thumb sucking is there, how can you do it? Plus, an added on is my elder sister had nail biting in the very early age, and my mom said that she would also use neem oil.
That's excellent.
And
Thank you for that.
the sad part for my mom was that she didn't care for the neem oil, and she had to go in either covering with the sleeves that you mentioned. So once the covering happened, then this she was consciously stopping the effort of biting the nail. So that's how it worked for my mom with my elder sister.
Yeah. Also, thumb sucking, you can make stories out of it, wherein, and kids love short-term goals. Don't make long-term goals like, entire month you do this and then I'll give you this. No. For them, short-term goals are 3 days, 2 days, sometimes 24 hours. So if the child has not been doing thumb sucking, entire 24 hours, reward them. There's a difference. Do not bribe them. Reward them, and reward them in a positive manner, maybe such that, take them to a zoo or a garden, but not with something like something to eat or an ice cream or something. Then, you deviate from the reward pattern. Yet thumb sucking, if it is not working and yet the child is sucking on the thumb, give the child a soft cloth or a blanket or mink blanket or something of those kinds, wherein they would like to touch a small soft teddy bear while they are sleeping. So, they can keep it all aside, and they will touch that and they would go to sleep rather than having thumb sucking habit. And the last resort is visit a pediatric dentist. We put on a clip which is placed in the upper jaw in the palate, and it's a very simple device. Kids parents feel that, oh my god, how will my child take it up? Absolutely not. It's a very simple device. We take the measurements, we place it in the upper jaw, and within few hours, or let's say within 24 hours, the thumb sucking stops. With that, we don't remove the clip immediately. If we have put it, we put it for at least minimum 3 to 6 months, or maybe depending on the severity, so that whatever your upthrusting of the upper jaw has happened because of thumb sucking continuously, that gets self-corrected. So this is very important. Once you have placed the clip, don't be in a hurry to remove it. So when you place the clip, the habit is gone, but the deleterious effects that has acted on the jawbone, that has happened. So the child has anterior open bite, or maybe the upper lip is a little raised up or something, that will get self-corrected because the child is in a dynamic stage of growth, not in a static stage. So we are taking away the abnormal forces from the jawbones, and the growth itself is the treatment. I hope that's answered, Sanaya.
Thank you. Very helpful.
Thank you.
Doctor, just to add on to this, because it's about thumb sucking, and I remember asking this to you myself, though both my children, Angela and Azriel, had never had thumb sucking habit. What about pacifiers? Because there is like Azriel and Angela never took the pacifier. Like I thought, why don't they take it? I had no clue. But I see a lot of Indian parents now using pacifiers. Does that also impact? Because that's a continuous sucking, that's the motion is what I see when I see kids with pacifiers. So just wanted to know from that perspective.
The pacifiers that are available in the Western world, maybe, the developed nations, and what available here in India are way different.
Okay.
Again, the pacifiers are given in Western world because of nuclear families, but then they know when to withdraw the pacifiers. For Indians, it becomes more of a fashion. And then once they introduce the pacifier, the parent does not know how to withdraw the pacifier. That's a concern. Second is whether it's a pacifier or a bottle nipple. They both do not mimic the normal anatomy of the mother's, the human nipples. So prolonged use of this pacifiers, I don't recommend pacifier even for a day. So prolonged use or even any use of a pacifier or bottle feeding again acts similar to the deleterious effect that impacts on because of thumb sucking. So it is more or less the same. And this habit is one which results in two further abnormal habits. One is tongue thrusting and the other is mouth breathing. So murgi pehle aayi ya anda. This is, we identify, it's whether mouth breathing resulted in tongue thrusting or tongue thrusting resulted in mouth breathing. So it's a different huge chapter to discuss, but thumb sucking is the way to develop abnormal other oral habits. That would be thumb sucking, that would be mouth breathing, tongue thrusting, and these have deleterious effects in the developing upper jawbones. And when the upper jawbone is getting hooded up, then sure the child will need braces in future. So pacifiers are again not healthy, they are not safe, and they are not good.
So, doctor, being from the space of preventive dentist, and as you said that thumb sucking, I don't know if we consider 10 people around me who have babies. Out of that, maybe one has a highest tendency of thumb sucking or so. I do not know the ratio, but let's say we have a baby, a newborn baby, and the thumb sucking is very natural. So, what do you think? How can we prevent them being from just few hours or minutes to being prolonged thumb sucking babies? Can we do something there? Like, I know that I used to remove Asriel's hand or Angela's hand whenever I see any of the finger going in, but what do you think is the right thing to do?
So thumb sucking, if we go by psychology, it is to pacify the child. And thumb sucking is an emotional balance the child undergoes. So if we were to go through Sigmund Freud's theory, thumb sucking is absolutely normal, but it is normal until 2.5 years of age. So that's when the child is in the oral stage of Freud's psychological theory. Anything prolonged to that, it not only impacts the child's growth and development, these individuals have a higher tendency of chewing gums or cigarettes in future.
Okay.
Because they are retained in the oral phase for a long period of time. Second on to this is thumb sucking is again rooted to psychological or social impact, wherein most commonly seen in working mothers. So the emotional bond is a little disturbed with the child, and to comfort the child, then the child gets into the zone of thumb sucking. What needs to be identified is what is the degree of thumb sucking. So when you ask out of 10, we need to first identify what is the degree of thumb sucking and what is the age in which the child is sucking the thumb. So I've already clarified the age, 2.5 max. Beyond that, we need to realize what is the degree. So whether it's only the nail portion that has been sucked, or it is till the first segment, or the entire thumb. Now, after thumb sucking, even if the entire thumb is placed in the mouth, whether the child is sucking or pushing, in the process, pushing the palate up or pushing the lower jaw down. So whether I'm putting the thumb in the mouth and pushing the palate up, or I'm depressing the lower incisors down. And that's what results in anterior open bite. That is, they have the entire set of dentition, but when they bite, you see a big gap in between the upper and the lower teeth. They're not covered or overlapping each other. They're like this. And when this happens, tongue thrusting and mouth breathing sets in. So the age of the child, the degree of thumb sucking, how often or the frequency with which the child is sucking the thumb. For that matter, whether even if it's 5 minutes or 1 hour does not matter. The degree is very important. How severe the child is doing it. Yeah. So thumb sucking is something which one should look at in the long run. Else, once the growth has happened of the jawbones, only treatment option later on after 14 or after the child has attained puberty is braces, but that will not correct the facial patterns. It will not correct the upper jawbone. It will not enhance the beauty of the face. So correcting or stopping thumb sucking at the right time is very important.
Just to share this with all mothers who are not only listening to me right now, but in the future, whoever is going to listen to me, beauty is very important. And trust me, your children will ask you, why didn't you take me to the doctor when I had this problem? So it's very important for you as a mother to know what it impacts. Yes, your elders will tell you saying that it's okay. Like, in the earlier times, like I will be having a session with the doctor who has treated Angela with adenoids, the ENT. And post that, we still are with treatment with Dr. Jogani for the, mouth breathing. And you will know more about mouth breathing during that session with Dr. Jogani, as well as Dr. Rahul Modi, because it's both connected. That's when, I see that connection, but the myth that doctors spoke about, I don't see that at all. So it's very important that if your babies are still young, like for example, Sanaya, you should visit the pediatric, whoever is in your vicinity, so that you can take corrective measures now before, you've lost that space. So that's what I would urge to mothers. If your baby is about 2.5 years or even reaching 2, and the severity is a lot, please do visit. This is my request. Please do visit, because it is important. If you do not go with, I have a boy child, so facial doesn't matter, that's not the era we are in. It matters. So please go, be it a male child or a female child. I will urge you to visit a pediatric dentist if the thumb sucking is severe in your baby. If you are not able to identify what is severe, still visit a doctor, just for your self-satisfaction. Because I have seen what doctor has done from thumb sucking to post-treatment, how the jaw alignments was. That's why I'm sharing this, or else I would not have. Because otherwise, I am also, shooting in the dark. Whereas right now, I'm not shooting in the dark. I correctly know what it is. The next question, doctor, here, which I think I am aware of it, but I want a lot of mothers to be aware, or fathers to be aware, is when we talk about mouth breathing, is it that the tongue is never resting in its resting place?
Okay. That's one of my favorite topics. And so I give each of you over here on the platform, please swallow. And right now, all of you have swallowed, I'm sure. So if you've done the correct swallow, your tip of the tongue would be resting right behind your upper front 2 incisors. Here. Yeah. So if your swallow is correct, you would be resting your tip of the palate, tip of the tongue right against your palate behind your upper front 2 teeth. And when we are, most of the kids who have tongue thrusting habit or mouth breathing habit, that's when the tip of the tongue is not resting against the palate. And the beauty of the tongue is, though the tongue is an organ of the lower jaw, it never rests on the lower jaw. It will always be adapted against the palate. Right now, each one of you must have again swallowed, and the tongue is right against your palate. Yeah. So when you are mouth breathing, the tongue is never against the palate, and the tongue is, resting in the lower jaw or in between the upper 2 teeth, and that's which allows the exchange of air through the mouth. So mouth breathing is very abnormal, and mouth breathing has a bigger picture. I would want you to take up a webinar on mouth breathing exclusively, because it's a huge topic to discuss on. It has impact on every aspect of your of your entire body.
To add on here, Angela is under treatment for mouth breathing. And if you want to identify if your baby has mouth breathing, maybe when your baby is sleeping, doctor, this is what you had told us, just open the jaw and see where is the tongue resting. If the tongue is resting not on the upper place, then that means they are mouth breathing. Doctor, correct me.
Yes. So you just gently reflect the lower lip or reflect the lower jaw. And if you see the tongue popping out in between the upper and the lower teeth like this, then the child is a mouth breather. If you see the incisors or the tip of, the incisal 1/3 of your upper front teeth, when the child is sleeping and the lips remain open, even they are open by 2 millimeters, just apart, then the child is a mouth breather. If the child is snoring,
this much.
Yes, 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 yes. If it's complete, the lips are completely closed, then your child is a nasal breather. If a child is snoring, if your child is hissing, whizzing, repeated episodes of cough and cold, preference to sleep on the stomach, saliva on the pillow in the morning, short attention span, flipping and tossing in the bed. If the child is having, repeated episodes of cough and cold, and whether you treat the cough and cold or you don't treat, the child will take its own time of 2 weeks to recover, then he is a mouth breather. So these are the cardinal red flags, the few questions that I enlisted, out of which most common that we have observed today is short attention span. So this needs to be corrected.
Doctor, the next question is, this is from my own experience, so I just wanted to, share some light on it, that there are newborns who are born with teeth.
Yeah.
So why? Because my older sister and my younger sister both were born with teeth.
I
And
just extracted one today morning, and that's when, you were asking me, so I couldn't answer your calls. So if a child is born with a tooth in the oral cavity, it's called as a natal tooth. And if the tooth erupts in the first 30 days of the child's age of life, then it is called as neonatal tooth. So whether it's a natal tooth or a neonatal tooth, any tooth within the first 30 days of life needs extraction. It is not a milk tooth. It is a pre-deciduous dentition. So these kids have 3 sets of dentition. One is the natal or the neonatal tooth, then the milk tooth, and the permanent tooth. And when we say extraction is an emergency procedure in such kids. The youngest child that we have operated so far is a 7-day-old baby, where we had to extract the tooth because in 7 days he developed ulcer on the lower, or the ventral surface, the lower surface, under surface of the tongue. Because when he was breastfeeding on the mother, and because of the tooth in the lower jaw, because of the friction and time and again movement, he had an ulcer. And once the ulcer set in, it was, it could be infected. The child stops feeding. And if the child stops feeding on the milk, what will the child feed on? And the tooth is so loose because these teeth do not have roots. They are just shells of tooth structure. And because they're just dangling in the soft tissue, there is a chance that the child may aspirate in the windpipe.
okay.
So that results in a further complication and an emergency. So any and every natal and neonatal teeth, we extract them. These extractions are absolutely pain-free and simple. There's only one emotion that a newborn baby will, a 1-month-old will give is cry. So when we extract and the child cries, does not mean he's crying because of pain. He's crying because that is the only emotion that he's going to exhibit. And it's very easy for them to cope up because immediately after, we ask the mothers to feed 2 hours before. We extract the tooth, and immediately after extraction, we give the baby to the mothers to breastfeed. So immediately when they're breastfed, because of the tongue pressure on the extracted site, the child is pacified because of feeding, and the bleeding stops, and the healing happens in 2 to few hours.
Doctor, any reason this condition happens? Is there any underlying reasons for it?
Well, the incidence is 1 in 2,500 for Indian kids. It could be many reasons. It could be some medications at the time of pregnancy. It is commonly associated with some syndromes, maybe a cleft lip, palate, or the child is just, just escaped from another syndromic condition. And it could also be associated with, some kids have fragmented tooth, or if the milk tooth bird has further fragmented at the time of birth. So that could also be a reason.
So, doctor, just to summarize what you just said, so does it mean that my both sisters are relying on their milk tooth and their permanent tooth is still underlining because they have not extracted it? So is there a possibility that they only had 2 or the third one is yet to come?
No, so they only had 2.
Okay. So that means they can have only 2 or some have 3. Okay. Okay. It's not like, it's will always be 3.
So anyone who's having tooth at birth, these teeth fall off or are extracted. And then after 6 months, the normal journey of a milk dentition and the permanent dentition sets in. Most of the times when at this age, most of the times, we don't have a clear history that whether the tooth fell down or the milk tooth came or it went.
Correct.
So most of the times it's all a normal journey.
Doctor, another question. This is with regard to toothpaste. We start solids by 6 months, and we start, I think, toothpaste by 12 months. So post the first birthday. So I just wanted to check that when we choose toothpaste that are in the market, they have sugars in it. So, and I know that, the quantity that you prescribed is a pea and a rice grain.
Rice grain size until 2 years of age.
Is that because of the sugar content that you are referring to, or is it otherwise? Just a question, which is
It is nowhere related to sugar content, because these are the sugars which are not inducing cavities. These are artificial sweeteners. These are sorbitol, xylitol. You have those chewing gums also based on those sugars. So it is not because of the sugar content that we decide the size of the toothpaste. It is just because until 2 years of age they cannot spit well, and this is the minimum quantity that you need. Unlike the Indian advertisements, wherein on a toothbrush they load the entire toothbrush and show you that we have taken the entire strength of the toothbrush and brushing. It's just a marketing gimmick to a visual effect to give you such that you start doing the same, and in the process you consume more and then you buy more.
Absolutely. Because if you don't consume, how will the companies make profit?
Yes. The most important factor, one of the leading brands of an Indian toothpaste, is earlier the dispenser, where the toothpaste comes out from. The dispenser was a smaller diameter.
Oh, okay.
And when they realized that the sales were not happening very often or regular, and to increase the pitch of sales, they increased the dispensing diameter. So any leading brand right now, for that matter, any toothpaste, they have a bigger diameter. So when you have a bigger diameter, you're dispensing more. When you're dispensing more, you're consuming more. When you're consuming more, you're buying more.
Absolutely.
So you need to understand what is needed. So a pea size, even for an adult, a pea size toothpaste is sufficient.
Yes,
You need not load the entire strength.
So just to let you guys know that I introduced Blippi, which is one of Azriel's favorite things to watch, and there is a song called as toothbrushing song, and it shows a pea, and that's what he puts on his toothpaste. So if you want to introduce that, please do that. Your babies are at least a year, 1.5 years, and they are not opening their mouth. That's another problem. So this is the new thing that I have started with Azriel, because he loves train, he loves excavator. So the brushing is choo choo. That's what I do. So that's amazing, because he even gives me a E to brush his upper and lower. And the tongue cleaner is excavator. So he opens the tongue and I say, it's a dirt, separator. So that's something unique that I've done since 3 weeks. So that's something that you can start if they like music, because it's easier for them to connect with music. And then you bring that in their real life, in the things they are doing. Doctor, going to the next question.
Parents have patience. I have seen Rashmita. Trust me, music plays an important role, and that makes me sing when I'm doing dental treatment as well. So, it really, you cannot be giving instructions to the child. Nobody likes instructions. You have to make it a journey. You have to make it a story. You have to make them accept things after they have understood it. Okay. So the same holds good for even thumb sucking. So when I say putting up a sticker or an emoji, they start relating with it. Yeah.
It is, because one of my webinars, if you see the webinars on potty training is also music, because you need to start, the humming or, the rhythm that is, or if you go back to how to soothe a baby, also is shh, shh, shh. So everything is related to music, and that's why it's the easiest way to, make them, learn things and get away the habits which are not good for the right age. Because when they are in the right age, it's okay, but we need to identify how to let them out of this. Doctor, this is a question specifically, for me, because I, try my best to do something for the environment. And I did buy toothbrushes, which are wooden, but I was clueless. What about the bristles? What are they made of? I'm clueless even now because I have not done my study. I'm sure you know it. Plus, with the knowledge that you've given me that I need to change their toothbrush quite often, that means if I'm going to go for the ones that are there, because what we also do based on this is, doctor, even when we travel now, we carry our own toothbrushes, we carry our own toothpaste, we don't use the dental kits anywhere as a measure. And that's something that I want to share it with mothers. If you love traveling, please do, but take your own stuff, right from creams to shampoos, because the bottles that you're throwing is not great for the upcoming generations, and they are our future. So doctor, something on this, like, what do you think? How do we pick? Is there some brand, something that you can share with me offline, and then I can share with the mothers?
Okay. Well, wooden toothbrushes are again good for the nature, but I haven't come across any good wooden toothbrush having soft bristles, because these bristles have a typical pattern of getting inserted inside. So not to flay, not to fray, and it has to have certain dexterity. It needs to have certain filament strength to stand up. If you're really concerned with the nature, then maybe also the another good option is getting a electronic toothbrush, wherein the entire handle remains the same. All you need to change is the head of the toothbrush.
Got it.
Yeah, I will check for you if there's something good with an wooden toothbrushes. But yeah, I myself have tried them, the charcoal based, the wooden ones. There's so many in the market. At the end of the day, everything boils down to it has to be a small head size, a long handle size, and a soft bristle toothbrush.
I'm just going through if I have any other questions, doctor.
Mummies do ask me, what toothpaste do you use for your daughter?
Okay.
I have never stuck to a specific single brand. The reason being, kids are excited to try something new every time. So a change in color, a change in taste, a change in packaging. Sometimes it's a Barbie on it, sometimes it's a cartoon character, sometimes it's an animal. The same is for the toothbrush. So I have not personally used any one particular brand. We have been changing every now and then, so it gives us an excitement to introduce it to her. At times, we have also done that this is a morning toothpaste and this is a night toothpaste. So she relates better that, when it's a pink toothpaste, it's her favorite. So she has to brush in the night. So that gives her an excitement. So these are the ways wherein you can, trick the child, wherein you get the job done of brushing. So morning, again, it's 3 minutes and night is 5 minutes, is because, again, in the night, we brush well, 5 minutes, we have ample of time before sleep. Morning, we have to rush for school and everything. So minimum 3 minutes is sufficient, but night 5 minutes. So again, we have 3 minute timer, a 5 minute timer, and all those things, 5 minutes, a song is running parallel when she's brushing. So these are the ways you keep the child hooked up to doing the real, activity on a daily basis without getting bored, or, it does not get monotonous for her.
So just to add on, because doctor spoke about the time, for every activity, any activity, children need visual, or they need something to understand the time, because they don't understand articulate time. Like, even if you have to sit and, suddenly you say 5 minutes, I don't think you'll be able to articulate 5 minutes, right? Until you put up a timer. So think about, it's so difficult for your children, for babies. I mean, toddlers, it's super difficult. So either buy, the sand, you have the hourglass, buy that, buy, timers, show them timers on your phone, or buy one instrument, they can put it up. Or, as doctor said, song is an amazing way, because they'll also enjoy it. And there's so many toothbrushing songs. for, you
So
know,
at times it happens that we are done with the 3 songs before bedtime, and yet she would want to hear more, so she wants to brush more.
Okay. Also, the other thing that I want to share, Doctor, which maybe you can give some inputs there, is a lot of mothers, what they do is they are scared to stop breastfeeding. Okay. And because of that, they replace breastfeeding with bottle feeding, and it goes on and on. I just want you as an expert to tell them that when they plan to stop, that means they need to stop. It doesn't mean replace it with cow milk or replace it with bottled milk, because that's what they need to stop, because otherwise they're not going to do any good to the dental health of their child.
For that matter, even they're not going to do any good to their overall health also. So weaning means weaning the child from feeding at night. Weaning does not mean stopping only breast milk. Okay, so once you have weaned, it means you have to wean the child from breastfeeding, you have to wean the child from bottle feeding. And that's where the child has already sustained himself on regular meals throughout the day. So you have to bring down or stop the feeding at night. That's more important.
So, Doctor, before we have the last message from your end.
I would just want to add again on feeding. So when we talk about feeding, we most of the parents introduce cow milk or the regular milk. Today's era, the dairy industry is fully adulterated. So I don't believe in the concept of milk for kids as long as they are eating good and eating healthy. I haven't introduced milk for my daughter yet. She's 5. It's a luxury for her the day she gets a milk in the form of some kind of a milkshake, or sometimes an ice cream, or sometimes turmeric doodh haldi, when she's not easy with her, she's a little with fever or something, or we are traveling. So my wife would give once in a month or twice a month. It's a luxury for her when she gets a milk. So it's not a common food pattern for her. And that too when we are Jain vegetarians, wherein we have strictly no other, animal food.
Just to let you know, mothers, even Azriel is a plant milk baby. And because I've tried and tested different recipes, and I've seen that, okay, these recipes are easy to make and it's acceptable. I've created even recipes. It's out there on my profile. You can click, and I've not made it expensive, so you can just take it and then post that. I've done a video as well for you to create your own recipes, and it's simple. We think it is complex. There are so many brands coming up now with plant milk because of, as doctor said, there's a lot of adulteration in the space of cow milk. And especially I was enlightened, because that is the word from why I should not have cow milk. And I stopped that for Angela when she was 3 years, is when I attended a webinar with Tony Robbins. And they spoke, and the webinar was not limited to only business. It was also about health. And they said why they're saying stop cow milk, because they're talking about these big cows which give liters and liters of milk, and we consume it, and how it actually impacts our hormones, because we are not that big. We are not that big mammals. We are small. So you can read a lot, but I have videos. So mothers, you can definitely check out, and we can go ahead with that. Very important thing for mothers. Yes, dentist is scary because I myself, when I think about the driller, it's like I don't want to go. And I always feel I have always been a baby, who can't tolerate pain. Especially for me, even when my mom comes with her her blood sample kit, I would not let her do that for 20 minutes, because I'm not scared of the needle, but I'm scared of my mom. So, whereas, I go for my blood test and it's okay. Or, I took my anesthesia on my spine, it was completely okay. So in the same way, what I want to share is that you have to know what to do, right? And that's very important. And with Azriel, majority of the things, how did I make it comfortable? Yes, when he visited doctor for his first visit, he was not, because I had not prepared him, because it was just about checking. But now when I know that, I didn't want him to have that fear, because one of the things, doctor, we were delaying because we didn't want him to have the fear. Because the pain that I put Aniket through when I had to get Angela pierce her ears is terrible. It's not an experience that I would want a father to have. And I know that, I have to hold Azriel and sit, or Aniket. It's not fine. It's not at all fine. So I had to prepare him. And it took me at least 2 weeks to talk to him. I kept talking to him. I told him, I am a dentist. So mothers, this is what you have to do. You have to pretend play. It's very important. You have to pretend play. Okay, now I'm the doctor. Open your mouth. And then he'll say, ah. Then I said, okay, now I'm going to do, okay, clean your teeth. Grrrr. So you know the sound of the drill. So I didn't know what will the treatment be, but I know, okay, the drill is there. So he was prepared for the ee sound. I'm not playing the video for you because it's already there on Instagram. So I'll give you the link. You can look back. And the other thing, he loves Blippy. So we ensured that the music is on, and you see the video where Azriel wanted to even sing when the drilling was happening. And I told him saying that, no, don't sing. And doctor's like, it's okay. He can sing. And Aniket was not holding him tight at all. He was even tapping him. So that experience is like, breathtaking for me, because I didn't bring in fear in him. Because fear is an emotion that you can't take it out from your child. It's very difficult. If I have to simplify, if you have had a dog who has bitten you, you are going to restrict your child to go towards the dog. Because you're scared, not because the child is scared. And if the child experience is the same, then it's going to be that the child will never want to go back. So now the thing is, you as a parent, let's say you're scared of something, what are you going to do to bring that child out of it? That is very important. So your role as a parent is very important. So if you're sending your children to school has their boundaries, but you have had your child, so you are the first one to actually educate them, is what I would want to share. And doctor, your message to all the parents, it can be on parenting, it can be on dental health, whatever you want to share before we close for the day.
First of all, thank you, Rashmita, for this platform. I had an amazing experience with the mothers, the kind of questions that have been put forth. Yes, definitely. In the most important segment, the myths. Yeah. Thank you so much. And well, parenting is a journey, so enjoy it rather than making it a task or, the checklist throughout the day. Enjoy it in a positive way, take positive vibes and take positive and good information from wherever you can. And that's what is more important. Dentistry is not expensive. Negligence is. So if you neglect a dental problem, you'll end up shelling, and then you complain that, it's expensive. It is not. So concentrate on preventive care. You can concentrate on preventive care at home care level, and just an annual dental checkup is more than sufficient what a child requires. And given the era, every child has to undergo a dental checkup every year, just like you visit a pediatrician. You should be visiting a pediatric dentist. So it's not for the teeth alone, it's for the overall correction and overall growth of the jawbones. This is an era where I see kids coming to me, parents coming to us in a hush hush, especially in the months of October, November, December, when the schools have started preparing for the annual day. And because of the child's profile, the front teeth, or whatever, the habits, mouth breathing, snoring, thumb sucking, and then the outcome on the face, the child is made to stand in the second row, in the third row, and that's where every child is precious to everyone, and everyone would want the child to be in the front row. Most important today, because of exposure to gadgets, speech is taking a toll on the kids. A lot of kids have delayed speech. So you need to have an annual checkup just to keep things in place and concentrate on preventive care and not reach on corrective or surgical care. So that's all about it. Thank you so much.
Thank you. just to end up, is with regard to Angela, also with regard to what doctor just said. She is a 7-year-old, and doctor has clearly explained to her that what would happen in case she does not use the treatment, doesn't do her exercises, and she clearly knows that her facial structure, which is just like her mother, will change. And sometimes she does not listen, and it gets difficult as a parent to continuously tell them, right? But this is what I tell her, saying that, Angela, I have told you, if you're not going to do it, when you are a teenager, you can go to anybody, but you cannot come to mama and say, Mummy, why did you do this? Because I have done my best, darling. But if you are not supporting me, cooperating with me, I can't do anything more. And that's when now, when I tell her that, she runs and gets her, her clip, and then she puts it. But yeah, it's difficult, doctor, for her to do her exercises. It's really a challenge.
Shall see you soon.
Yeah, and the other thing is the doctors are not, I don't know, I come from a marketing background. We run a digital marketing agency. So just mothers, whenever you go to doctors, doctors cannot prescribe brands, just to let you know, okay? That's their profession. They are supposed to not, so they will never talk about buy A product or B product. Hence, you will see doctors not endorsing. And in an ad, when you see a guy with a white coat saying, buy this, he is not a doctor. Okay? This is for your education that I wanted to share. They are not doctors. They are just actors who are saying, buy it. So kindly be cautious. I have shared with you an interesting reel where the cookie was honey and oats, and the percentage of honey and oats was less than 10%. The same way, when you see things with your eyes, do not believe it. Go deeper, understand, then take action. So that's all, doctor. Thank you. And I'm sure 1 hour was not enough. And thank you for your patience, because in between I just ran because my laptop battery has drained out. And I told Aniket I cannot stay. And Azriel was just looking at me that, okay, what is she doing? So
Okay.
for your time of these 2 hours is something that I didn't expect. Thanks a lot.
Thank you so much.
See you again, because we have a big segment to touch base on mouth breathing.
Yes.
Because one of the things that I want to share is the only reason my mom was detected of sleep apnea was only after we decided that Angela will sleep with my mother, and my mom has extreme snoring. So we will also touch base on that, mothers,
Yes.
what is sleep apnea. That's another thing. Please read about it if you don't know. This is in the adults. I'll repeat it again, sleep apnea. Thank you.
Let me take a moment.
Sure.
Sleep apnea is not in adults. Sleep apnea starts from infancy. It is not identified because of lack of awareness. And that is where most of the kids land up having seizures, nightmares, crying in the night, short of breath, difficulty in swimming. They could also have early onset of asthma, breathing issues, repeated episodes of cough and cold, and array of more other symptoms. So pediatric sleep apnea is more common than in adults. It is because of infancy, they grow with sleep apneas, and once they become an adult and then they realize the problems that they are facing, is they can express. Kids cannot.
Sure. So, doctor, one more topic for us to touch base with.
Yes, this is important. This is a part of mouth breathing.
Sure. Okay. Thank you, doctor. Have a good
Thank
night.
you so much. Keep smiling.
Yes, doctor.
Thank you.